everyone, welcome back to Dental Simplified with Fatima. Today we are going to talk about something very basic but super important, that is the tooth numbering systems. We are going to discuss FDI system, ADA, and the universal system. So now before we jump into the system, let's quickly understand why does tooth numbering even matter. So basically it's all about communication. When a dentist says a tooth number, every other dentist should understand exactly which tooth they're talking about. This helps to avoid mistakes in diagnosis and treatment, and also is very important for maintaining proper clinical records. Now, here the golden rule is that always think from the patient's perspective. The patient's right is my left. For example, here it says upper right. So this is the patient's right side, and it's going to be from clinical perspective my left side. So it's always the opposite. And the mouth is divided into four quadrants. We divide our oral cavity in order to make it easy and like also to form a foundation for our tooth numbering system. Now here you see we have our quadrant number 1, quadrant number 2, 3, and 4. So we are going in a clockwise direction, and the maxillary arch has two quadrants and the mandibular arch has two quadrants. In total, our oral cavity is being divided into four quadrants. In order to represent maxillary arch, we say upper right, and for the mandibular, we say lower. For the maxillary, we say either upper right or upper left, and for the mandibular, we say lower left or lower right. All right. So let's start with the most important one, which is the FDI system. This is the international system that is used worldwide. It is actually very simple. In here, we are going to use two digits. And the first digit, it tells you about the number of the quadrant. So for example, let's see here, we have 1, 1, 1, 2, 1, 3. So the first digit is giving us an idea that this teeth belongs to quadrant 1. And then in here, we have our tooth number 2, 2. So our first digit is going to tell us that it belongs to quadrant 2. And now the second digit tells you the position of the tooth from the midline. So it's a two-digit system. First digit gives us an idea about the quadrant, and the second is the tooth position. So if I say tooth number 1, 1, so 1 tells us that it belongs to the quadrant 1, and then another one tells us that this is the upper right central incisor. For example, if I were to say tooth number 3, 6 is to be extracted. So from the first digit 3, I get to know that this belongs to quadrant number 3. And then 6 represents the first molar, and as it is quadrant 3, it is the lower left side. Alright, I hope it's clear. Now let's have a look at this OPG. Here we see that how our quadrants are divided in like a real clinical based practice. So we have our maxillary arch and mandibular arch, which is further divided into two quadrants, our first, second, third, and fourth quadrant. And the first digit here is telling us the number of the quadrant, and the second digit tells us about the position of the tooth. So in total, we go from 1 to 8, and then from 2, 1 to 2, 8, 3, 1 to 3, 8, and 4, 1 to 4, 8. We don't go continuously, and always remember that we start from the midline. We don't start from our end, no. We always start from the midline towards the end, and again from here, the midline towards the end. Now, what we were talking about was all about the permanent dentition. Now, when I talk about primary dentition, our quadrants are a little bit different. We don't say 1, 2, 3, 4. In here, we are going to start with 5, 6, 7, 8. So the tooth number, like the second digit, is going to be same. The position of the tooth is similar. For example, in my previous system, like in the same system, but in the permanent dentition, my central incisor was tooth number 1. Here is same, number 1. But only the quadrant number is changed. As you see, it's 5, 6, 7, 8. Again, we are going in a clockwise direction. Maxillary arch comes first, and the upper right part comes first. So we always go from here to here in terms of quadrant. And again, for the tooth position, we go from our midline towards our molars. And as you know, in the primary dentition, we have 10 teeth and 10. So now moving on to the universal numbering system. This system is mainly used in the US, and unlike the FDI system, it does not divide our oral cavity into quadrants. Instead, here we follow a continuous numbering pattern. So for example, here we have our permanent dentition. So the numbering, it starts from the upper right third molar, which is our tooth number 1. Then we move across the upper arch to the left, reaching tooth number 16. After that, we drop down to the lower left molar, which is number 1717. And then we continue all the way to tooth number 32, which is our lower right molar, third molar. So basically, it forms a loop around the mouth. There is no quadrant and it's very easy, but it's just that with practice, you will be able to memorize them and see it at like, once in one instance. Now, moving on to our primary dentition, the concept is similar, but instead of numbers, we use alphabets from A till T. So again, we are going in a continuous loop. There is no need for quadrants, no need of stopping here. We go from J to K and then again towards T. Why are we using alphabets? Because it helps us to differentiate primary teeth from the permanent teeth, avoiding confusion in records and communication. So we easily know that which dentition we are talking about. All right. So this is a kind of summary. You can take a screenshot of this image and you see here, this is for the permanent dentition and then this is here for the primary dentition. The concept is same. We go in a continuous loop, but just here we use alphabets in primary dentition and and numbers in the permanent dentition. Now let's move to our last numbering system, which is the Palmer notation system. This system is somewhat similar to the FDI in terms of tooth positioning numbering. So, for example, the central incisors in here are still numbered as 1 and lateral as 2 and so on. But the only difference here is how we are representing our quadrants. So in the FDI system, remember that now we had like two digits. First digit represented the quadrant and the second represented the tooth position. But in here, we just have the numbers that are representing our tooth position. So number 1 is the central incisor. But the quadrant is being represented by a unique bracket. So this is our right quadrant. And then this is our left quadrant. And then our left lower left quadrant and lower right quadrant. This system is commonly used in orthodontics because it's visually very clear. You can like instantly identify both the tooth number and its quadrant, and it's very easy to make comparison like between right and left incisors, making it much easier. So here we are talking about the permanent dentation, and if we were to talk about primary, you know that each arch has like 10 teeth. All right. So now let's do a quick comparison. Let's take the upper right central incisor as an example. So first of all, in our FDI system, it is written as 11. So first digit is representing our quadrant and the second digit is going to represent our tooth position. It is also internationally recognized. Then in the universal system, it is tooth number 8. So because the numbering runs continuously from the upper right towards the upper left, so you gotta imagine that image, and in that way you will be able to tell that it is tooth number 8. Now in the Palmer system, it is represented as 1, and our quadrant symbol is going to tell us that this is the upper right. So here you remember the upper right is represented by this symbol. Okay, so now the key idea is how you can remember FDI is quadrant plus tooth, universal is one continuous number, and Palmer is number plus the symbol. So this is a dental tooth chart which represents and summarizes all the three systems. You can take a screenshot or refer back to it anytime for revision. So let's talk about some common mistakes and how to avoid them. First is the perspective. Always imagine that the patient is facing you, so their right side is actually your left. And in clinical practice, for example, if I am facing the patient and I talk about the upper right quadrant, so it's going to be my left side. Then secondly, we talk about the quadrant confusion. In FDI, number 5 to 8 are for primary teeth, not extra quadrants. So our oral cavity is divided into 4 quadrants, 1, 2, 3, 4. But for primary teeth, we go 5, 6, 7, 8. And then third is that don't mix the systems. Never combine universal and FDI in the same chart. For example, 1, 6 can exist in both the systems. If I say 1, 6, and if I were to be talking in FDI system, it would mean that I am talking about my upper right first molar. But in universal, it means a completely different tooth. So you always need to state that which system you are using in order to avoid miscommunication. So my final tip to you guys is that mastering these three systems, it requires practice. At first, you might need to think and visualize the charts and all the symbols, but over time, it becomes instinctive. And practice with real cases, revise regularly, and try identifying random teeth with like different systems. And once you get comfortable, you will be ahead in both exams and clinical practice. Thank you guys so much. And if you will have any questions, you can comment down below. Thank you for your attention.